Taiwhenua Heretaunga started 30 odd years ago in the back of a barn somewhere as a provider of workplace employment for people, and grew into a health and social services provider. Especially over the last 10 years, we've grown significantly. We've got about 12,000 people that we work with every year. We've got about 300 staff on payroll.
We've got social workers, counsellors, got GPs, nurses, anything you can think of, we've got here.
We had a myriad of systems. We had spreadsheets and Word documents and things like that. All the time you spend in administration is less time you're spending with your community at the front.
There was a lack of scalability, adaptability, accessibility. Sometimes we were down for long periods of time, and for staff that caused a whole lot of frustration.
All of those challenges were huge for us.
We were at the point where we had to think about, okay, maybe we need a managed IT service provider who will be able to help and support us find an affordable and reliable system.
Yorb's business philosophy is business-defined technology. So what we mean by that is we've turned the conversation on its head and we talk to the customers about their business, we understand their pain points, what their business strategies are, and then we'll define technology which will help them from a business perspective.
And the other thing that's really important is to make sure that there's an alignment of culture and values. When we chose the provider, which is Yorb, we knew that we had a group that was interested in us and understood our values and what we wanted to achieve for our community.
One of the reasons that made me join Computer Care as it was, and now Yorb, was around the culture. Real family feel, the staff and the culture around the staff, very important to Yorb. If you think about that in the context of T2H, T2H is all around the culture of their people. So I think from a business perspective, it was a cultural fit between who Yorb is and what T2H are.
The clients we're seeing these days, a lot of the time they don't know their risks because they're doing their job, they're doing their work on a day-to-day basis.
We didn't want to have to learn all of these things ourselves, so Yorb brings with them all the experience around, here's the future pathways for the use of our technologies.
It is our function to make sure they're aware of what these are, and we show thought leadership and innovation in how they can leverage those technologies.
We tend to develop a roadmap and say, here's a roadmap for your network for the next 12 months, try and give them an indication of the sort of budget they need to keep their system running at levels they require.
What's their business strategy? What's their business pain points? How can technology help?
And they've never ever tried to sell us anything more than we've needed, so we're really happy with that.
They're good communicators. They were there, they were receptive, they were supportive.
Obviously we spend a lot of FaceTime with our clients on those journeys. We'll do workshops either on-prem or within region.
And Microsoft 365, I think, for us has truly enabled us to deliver our services to the communities, not only for now, but future-proofing. So we use Teams. Teams has been really, really great for us, especially with our video conferencing, as well as SharePoint. With SharePoint, we actually use our collaboration sites. So I create the sites for some of the services, and behind those, we also use the Microsoft Flow function as well, which has been really great. It's automating a lot of our processes, which, in turn makes us a lot more efficient.
Moving to the cloud, I think, has been a boon for our organisation in terms of us not having to be so concerned about our data being in one place.
So with T2H, obviously not-for-profit type of organisation, a lot of regulatory requirements as well, especially as they're holding patient data. We had to consider as part of our proposal in moving to Azure, what did that mean from a Ministry of Health perspective?
The Ministry of Health and the Ministry of Business Innovation have both signed off Microsoft and Azure, and they're now saying Australia is a suitable place for your data.
So that kind of put their mind at ease with regards to some of those requirements. So to prepare a company like T2H to move to the cloud without disruption, it kind of belies a lot of the work we do in the background that they wouldn't necessarily see. A lot of pre-planning, a lot of pre-testing, so much so that when they go live, we're flicking the switch and it just works, but they're not aware of all the work that's gone on in the background.
The migration went really well. A testament to the team that worked on the migration,
Everything went seamless. It's been wonderful.
we had no problems. We're looking at greater productivity, we're more collaboration on documents, and all of our staff being mobile. As a chartered accountant, it's important that the investment we make into technology actually has a payback.
So how we help companies like T2H from a cost management perspective, because obviously as a not-for-profit, cost is very important to them, is across the board from a technology perspective, leveraging infrastructure as a service and some of the elasticity that we have in that. From a process perspective, could they work better and smarter and leveraging technology, for example, Microsoft Flow, to put some productivity benefits into how they work.
Most of our contracts are designed so that we report back to our funder around the things that we've done. So the critical part of that is to make sure that we're delivering what we say we're delivering. Realistically, yes, we're going to do the work out in the community, but the community is not the one that actually pays us directly. We need to be able to provide our funders with access to that information to say that we've actually done the work. But if you can make the process simple and easy, then you're on a winner.
So some of the emerging technologies we're considering for customers like T2H is more around patient and the analytics around the data they're holding on patients. They've got this data, they know from when that patient was born through to when they're 18, what journey did that patient go on? And if they can analyse that data and make smarter decisions in how they give healthcare to that patient, that's got to be a benefit for their patients. And top of mind for many of our customers is security. Very big discussion point at the moment.
Probably the area that a lot of people are still not taking seriously enough, and we're working really hard to say to our customers, you need to take this seriously. It's not just the Facebooks and the Googles getting attacked, it's local businesses in the regions. We've really got to get the customers aware of that, because that's stage one. If they don't care about it, they're not going to do anything about it. So we have the monitoring tools that run on every PC, every server. We also have network monitoring tools to look at network performance, switch utilisation, latency, things like that. Knowing that if this system goes down, their payroll can't be done, or making sure we understand what the collateral damage to those changes are.
Our dream was just to have a stable environment. Now we have a reliable IT infrastructure here, so that allows us and the IT team to focus on where we're going to next. Well, we do have the tools now to stay connected with our whānau, our communities out there. It's been wonderful.
So one of the things we found since we put in the new IT environment into T2H, now we've got a solid foundation from a technology perspective that also allows the people to kind of get back to their day job and do what they're paid to do and not have to worry around the technology. It just works.